Let me welcome my guests this morning for our assessment of the progress so far and the challenges. And I seek to find out, because you have been asking, are we expecting extreme measures as Ghana's infections, not infection rate, I have said infection rate, the number of persons infected surpassed 2,000. In fact, we understand that soon, when the process or the Ghana Health Service portal is updated or the president speaks to us, we should expect that the number will go up close to about 1,000 more. But there are interesting and very good stories about the recoveries that are going on and the contact tracing that is in an advanced stage. Of course, we know that the testing centers have now multiplied, therefore giving Ghana a chance to do a far better job than its peers within the sub-region or in Africa. So, we will deal with those issues and also ask the questions about the politics of the abandoned hospitals and the promise of 94 new hospitals in this year alone. My guest this morning, Dr. Patrick Aboagye, is Director General, Ghana Health Service. Dr. Justice Youngson is General Secretary, the Ghana Medical Association. We'll be joined on the phone by Kwame Sapong-Esedu, pharmacist and fellow, Ghana Center for Democratic Development, CDD Ghana. But we are also interested in knowing how you assess Ghana's progress so far, particularly after the lockdown was lifted. So we give you the opportunity first, send in your messages, but we should open the phone lines for you to also make your contributions. We want to hear from you so that those at the forefront will answer your questions. What are some of the challenges you have? What are some of the difficulties you encounter as a result of the measures in containing the spread of the pandemic? Let's begin by listening to Dr. Patrick Aboagye when he addressed the nation and told us about the numbers.
As of this morning, the final count that we have is that we have 1,671 cases. Of this, 563 has come from general surveillance, which is those who fall ill and approach the hospital and they are tested. 105 still remains part of the earlier quarantine, 10 from the quarantine in Tamale, and those we had from the enhanced tracing. That is the group that we actually went out to look for. We found 1,113, bringing our total to 1,671. Currently, about 1,461 are well or no symptoms and are responding very well to treatment. We have about 6 who are moderately to critically ill, 2 at UGMC, 3 in Ghana East, and 1 in Kolebu as we speak today. All the other parts of the country, we do not have any critical case there. For recoveries, we have recorded 188 of all these people have recovered. And we are hoping that there are more waiting for discharge, awaiting their second test to be discharged.
Right. So Dr. Patrick Aboagye is here himself. We will get to update ourselves on Ghana's situation. As you know by now, we now have confirmed 2,074. I don't know if you have gone beyond that yet. And then we have 17 deaths and we have 212 recoveries. We will deal with those shortly. But as we begin, we want to take your calls. We want to know your circumstance, where you are, particularly if you have somebody who has come into contact or who perhaps is being quarantined, or you have gone through this process yourself as quarantine yourself, and you have something that may be useful to help us assess Ghana's progress in the fight so far, or enlist the challenges so that it will guide those at the forefront in managing this situation in the way forward. The number to call, or the numbers to call, are 0302 2211 691. You can call that number. 0302 211 691. 691. Or you can call 0302 211 692. 692. All right, so let's first take our first caller, Kofi Usu. Kofi Usu, where are you calling from, and what do you have to share with us? Hello, Kofi.
Hello. Good morning.
Morning, Kofi. We can hear you. Where are you calling from, and what do you have to share with us?
Yeah, from Kumasi.
Great.
Yes, what I want to say is that, yes, I know the leaders are doing a fantastic job. I traveled to Chicago and then returned on 11th March. Now, on 11th March, when we came, there was nothing from the government on us. So we came home together with my wife. Then we went to church. Then the president announced. So we decided to stay home for 2 weeks, self-quarantine ourselves. We did that, and then some numbers came. We called. Fortunately, a lady picked the number, the call, and then directed that some people will come to us. Then the president said, all those who travel between 3rd March should call so that they could be tested. I made effort and I called. So the immigration officers came to my house on 8th April, took my sample, sputum, took it on the 9th. As I speak to you now, Samson, I have not heard anything. The mental torture I go through every day. And the last...
So your sample was taken on the 9th of...
On the 9th of April.
9th of April.
And when the president spoke when we were about 60,000, he said there was a backlog of about 18,000.
Okay.
Now we've hit over 100,000.
All right. So,
and I still don't have results.
All right. So, Kofi, you are anxious to know your status. You and your wife?
It's so...
Thank you.
I don't know.
Thank you, Kofi. Thank you very much. And let's get to Promise. Promise is calling us from La Paz here in Accra. Hello, Promise. Hello, Promise. What do you have to share with us?
Hi, Mike. So I think the problem about us is about the market women. You see, they watch TV always. But since when authorities go to the market to try to let them why they should enforce the social distance, they keep retaliating. The last time I saw a video from Medina. And I think that we citizens are making the work difficult for our authorities to handle. So I think my contribution is, if we are watching this program and speaking with you, take our time, do what is necessary. We shouldn't wait for the numbers to go up before we become serious.
Thank you very much, Promise. Right. Your concern is about non-compliance, particularly in the market, non-compliance with social distancing and the measures that are supposed to be in place. So, Jeff, you're calling from Tamale. Jeff, what do you have to share with us?
Yes, what I have to share with you is that the protocol on social distancing is not adhered to in Tamale. There are areas all over, so I don't know what authorities are doing.
What do you mean by it's not adhered to?
You can see people more than 25. People more than 25 having amaria and going on in Tamale.
Okay.
When you get to the bars, more than 25.
I see.
Meanwhile, I heard the MC gave order that all bars should be closed. Meanwhile, they are still operating.
Okay. Thank you, Jeff. Now, the important thing to note is that there is no permission to hold an amaria, like a wedding, There's no permission for it. The permission given for 25 participants maximum is for burials. Burials. It's not for anything. So if you want to do anything that is prohibited by the law, conferences, workshops, religious activities, festivals, all of those things, sporting activities, prohibited completely. It doesn't mean that you can do it with 25 people. Let's get that very clearly. Who is Trinity? Trinity, where are you calling us from? And what's your concern? Or what do you have to say?
Hello?
Yes, Trinity, you are calling from Hafasini. What do you have to share with us?
No, I'm calling from...
Yes, go ahead.
The latest figures we had.
You are calling from where? You are calling from where?
Hafasini.
Hafasini, okay.
Yes. The latest figures we had as of 3 or so days ago, are they still from the backlog of cases the president talked about? And 2, if that be the case, does that mean we are not having new infections? I think no new cases are being recorded. And 3, why are we still not getting daily record of cases? Because if you should go by the model, then the graph or so that you talk about, how are we then able to draw the graph to be able to ascertain whether we are flattening a curve or we are peaking or we are not? So I think the daily reported cases will help us be able to draw the graph that experts talk about. Thank you very much.
Thank you very much. Trinity calling us from Hafasini. And whilst we wait to take just a couple more, we just want to have your ideas of what you are thinking and what is going on with you before those who are at the forefront of managing all of this begin the discussion. Vincent from Nkrakan, Eastern Region. Hello, Vincent.
Yeah, hello, Samson.
Yes.
Yes, my problem is that in my district here in Kraken here, it's under Yilo Kobo in the Eastern Region. There is a very big market here on Thursdays and Mondays. But if you look at the market, I don't know what our...
Okay, we seem to have lost Vincent there.
Yeah, something I'm around.
Okay, so what you're saying is that there is no compliance with the protocols in the market.
There's no protocols in the market. We are not seeing the DCE in the market. They should come. We have other schools around. So they can do the satellite market and move the food the sellers and some of the people around to trade places. But they are not doing it. So they should come and do the things for us.
All right. Thank you. Jabal. Okay, Jabal. Jabal, you are calling from Tamale. You should be my last caller. Yes, Jabal. The rest of you can send us messages and we'll share them with the experts here. Yes, Jabal.
Yes, Samson, I'm calling from Tamale. A gentleman called from Tamale called Jeff, and he
said that the protocols are not being observed, particularly when it comes to...
I disagree with him on that score. Yes, nationwide there have been infractions, and those he's mentioning are the general infractions that normally happen at other places. But with the general population, I must say there is general compliance. So it is not very true that the people of Tamale are not adhering to it. Otherwise, the security agencies and authorities would have taken that up, and you would have heard about it.
All right, thank you, Jabal. Thank you, Jabal. So we'll take, I said my last, this should be my last caller then. Alfred, you are calling from London?
How are you?
I'm good, thanks for asking. Yes, what do you have to share with us, Alfred?
Just a quick one. I've just been watching you and I see your take and the video that came up with the social distancing. What I want to say is the very people that are supposed to make sure social distancing is working, because the president cannot be everywhere. There are certain people in certain areas that have to observe and make sure whatever the president has come out to be adhered to. It's very pathetic to see that chiefs are organizing this with support of the security don't know how you can tell someone to isolate to social distance. It's the highest of everybody. The first highest that's supposed to be 26 are flattening the laws.
All right.
So I'm sorry. The authorities must really deal with it.
All right. Thank you, Alfred. Thank you, Alfred. Thank you very much. Okay, so like I said, all of you, please hold on. You can send us messages about whatever you want to share with us as far as Ghana's fight of the pandemic is concerned, and we will let our guests respond to them for you. Now, I said I'll start with Dr. Abuaje, but let me go to the phone lines and talk to Dr. Augustina Angelina Silverkin, who is a lecturer, Department of Theoretical and Applied Biology, KNUST, and research scientist and virologist at the Kumasi Center, the KCCR. Thank you very much, Doc, for joining us. Great. Okay, so let's begin with what you must have heard some of the callers, practically complain about. The majority of the complaints are about non-compliance with this protocols, particularly social distancing, more particularly in the market. Why do you think people don't seem to want to comply fully? And what are the risks if this doesn't go on correctly?
Indeed. Sometimes, so for those of us who do the testing in the lab, we get to the lab, we do our testing, and then we come out of the lab and we see what people are doing, and we are like, we honestly don't know what is going on. But I'm just thinking that maybe it boils down to education. People assume that the virus is somewhere, or some way, somehow, the virus has vamoosed into thin air. I mean, I have heard people make interesting comments pointing to the fact that as soon as the restrictions on movement some way, somehow were lifted, it meant that the virus has also gone somewhere, vamoosed into thin air. I don't know whether people are waiting to see people dying, rushing to the hospitals. But remember that we don't have such very strong health system. So I don't think we even want to go to that level or get to that level. I mean, we have very limited ventilators, and I keep on asking myself, of course, the number of people who even survive on when put on ventilators. So maybe education hasn't gone down very well. Do our people even understand what social distancing is and the effects this social distancing can make in limiting the spread of the virus? Have we also involved our local people in our environment, in our communities, the local people, such as the chiefs, opinion leaders? When you go to the markets, they have queen mothers, yes. They have leaders, and honestly, I'm expecting to see that leadership role they have been played out very well during this time. I know that in the Ashanti region, I always comment the Ashanti region. We know that for some of the markets, honestly, they had to be closed down. For some other markets, they were given color codes. So, for example, they were given yellow, blue, I don't know the colors.
Yes.
So that if you had a yellow color, then it meant that
it's red, yellow, and green. Yeah.
Exactly. So you had designated days on which you had to go to the markets. But I know that definitely some people took advantage. Some people were doing their own things. I know that
some faked it, and they were arrested.
Yes. So maybe people haven't really gotten the message very well. I have kept on saying that maybe we have been giving out a lot of information. Now our people have a baseline, a foundation, which is excellent. You always need to give out information. But then I think on top of the information, we may want to be doing education. I mean, I always hear this particular advert and I don't even want to listen to it. It goes like, don't touch your face. I know it is difficult in the local language. Meaning, but if you know that the thing is difficult, then why don't you explain why it is difficult? And look, with these millennials around, they always want to know why. So I think that we may want to, I mean, Ghana, we have done very, very well. But maybe we may want to re-strategize. We may want to add some levels in terms of education. And I'm sure that, and of course, involving our local chiefs, our opinion leaders, there's something known as local ownership. So that, for example, if that Queen Mother is the one spearheading this social distancing and even explaining, and what I also ask myself is that, do our people even know what 2 meters is? Do we know what 6 feet? We know that, I mean, if you stretch your hand, that's a meter. If the other one sitting close to you also stretches his or her hand, it is also a meter. So if we can go down to the very basics, I'm sure that something, our people will comply. And of course, if we show on screens, TV stations, show that, look, this is what is actually happening. I'm positive that people would adhere to all the things we have been
So as we know, actually the local government ministry is the one spearheading the alternate markets. And local authorities are supposed to strictly enforce that. Where the markets are crowded, they are supposed to ensure some sort of easing up of that market and create alternative places. So is it that the local authorities perhaps are not working in tandem with the medical experts to know that this has to be enforced? Is that what is going on? Because if you read the report, you hear a lot of people, even on social media, also complaining. They have gone to the markets and it doesn't appear anything is going on. People have spoken about their Boboloshi market and so on and so forth. What can the authorities do?
I think they may want to enforce, maybe add some level of enforcement. I don't know if we want to involve, of course, if people are not adhering to these measures, then we may rather add a level of enforcement. We may want to involve our security agencies, because look, every single body is at risk. I mean, I heard in one of the districts, the market women themselves, and I think we should also be promoting, talking about such heroes and heroines. I know that one particular district, the market women themselves actually enforced, or they have enforced the social distancing, even gone beyond social distancing, and they have added the wearing of masks, so that when you get to their market and you are not in mask, they will actually turn you away. I think we need every single hand on deck. We cannot leave this to only the local authorities to be doing everything. We have to own all the things we are doing, some of these mitigation strategies.
I'll get to Dr. Boadio right now, but can we look at this issue where Kofi Usu in Kumasi is not particularly happy about the fact that he and his wife, their samples were taken on the 9th of April, and they still don't have a word as to what their status is.
I mean, something definitely, I share in their anxiety. I would have been very, very, very anxious. But a lot of factors may have resulted in this. Look, sometimes you receive samples and the samples are not well labeled. Sometimes they are not well closed. And the unfortunate thing is that now we are using sputum or nasal washes, and these samples go into a wide mouth container, and they need to be capped. There are screws, so that if they are not capped well, then the samples would be taken all right. But in transit, in transporting it to the lab, chances are that you may end up losing everything.
Okay.
And I mean, Ashanti region, usually when the regional health directorate is organizing meetings, they invite some of us. We take participants through some of these things, spelling things out very well for them.
Right.
So I would be anxious. And it is also possible that really the results may have actually been sent, but maybe it is sitting in somebody's email because, you know, these are patient data, and you cannot just call me for me to tell you that, oh, you are negative or you are positive. We have a process. So our director would, for example, send the results to the region, and then the expectation is that the region will send all the results to the various districts. And sometimes it is possible the results may be sitting in somebody's email, where we have internet challenges. Some people are such that they don't check their emails on hourly.
So Doc, I'll return to you. Then we will start an assessment proper of the progress and the challenges. We have heard challenges that have been, mentioned, even from those at the front line and so on. We would like to know what challenges there are and what you take as the successes that have been made so far. But Dr. Boaji, if we can first look at the concerns that came in. Kofi also called first.
Yeah.
His situation, Dr. Silver King, who I suspect will be the ones, KCCR, they would have done the testing for him. What explanation do you have for people like that? He's not alone.
Yeah, thank you very much, Samson. Yes, we have similar explanation. I think the doctor mentioned some of the possible issues, but when samples are not appropriately taken, resampling is done. There's also a lot of emphasis on reporting positives. And communication may also have been a challenge. But I agree that it's possible that the results are there, and we should be able to look for his results. If it's been done, I should have it. And if I know his name, we'll be able to ensure that he gets his results. Usually, there are a lot of emphasis is placed.
He mentioned his name, Kofi Usu. But the thing is there not some protocol that would have that at least you would have been contacted and told that your sample has gone through this process, this is where it is, hold on, you should expect it within this period or that period. The anxiety may kill,
Thank you. I think that's what I was getting to now. The protocol is that the samples are sent to the lab, results are sent to the region, national level receive their listing. Immediately the region gives it to the district where the person came from, a hospital that took the sample. Because of the nature of the situation, we want to have those who participate in taking the sample inform the person.
Okay.
And before we report. And that is why I keep telling you that's why we delay in our publication of our results, especially in the early phases when there were few cases, which was very easy to say who is who.
All right.
So that's when we do. So I'm sure there have been some error in reporting or not being reached or whatever, but it's something that can be corrected.
Okay.
Easily. And because we push a lot more for the positive, and the tendency to ignore the negative, it's very likely that he's negative. That's
our caller from Half-Assini Trinity wanted to know whether or not what you have on the site now includes the backlog that the president spoke about, and he also asked to know about what we have stopped speaking about for a while now. Where are we in the curve? Which of the curves, I suppose you will ask.
That's a very, very technical question. Yes, we still have some backlog. And with the ramping up of our labs now, even now, I just got a message from the professor, they are doing that, and they don't have any backlog in Volta region and OT region where they are captive, where they cover.
Yeah.
We are closing the gap, but we still have some backlog, especially in Kumasi, KCCR, where the numbers are done. But we're currently building capacity in Konfanochi and other places. So that number includes the backlog.
Okay.
And so you may have in a day reporting a sample of about 6,000 to 8,000. Definitely that is not the day's collection. There are previous backlog that is in. But with the expansion of all our labs, we are hoping that by the end of next week, we should be able to report in real time.
All right, Dr. Hansen, the majority of the callers
just to add,
about the social distancing.
In terms of looking at the curve, maybe those are the things that we use in the strategizing.
All right.
We also know when a sample is taken and when it's positive. So we are able to go back and look at samples taken on 24th. How many are positive? And that is what we plot to see where we are. And currently, we are not seeing any increase in this, and we are virtually stabilizing. That's why we are not too worried.
That's a good job. Now, Dr. Hansen, majority of the complaints were about lack of, compliance with the social distancing, protocols in markets. We've heard about food vendors and taxi drivers, who have also tested. How else do you think, we can go about the education to ensure strict compliance in the markets more particularly?
Well, I think that we need to do a quick assessment of the situation, which to a large extent is being done. But we need to bring a conclusion to that and then relook the approach to the social distancing and possibly include some enforcement measures. Everybody
Any specifics you are looking at?
Yes, everybody seems to be talking about the markets, but the business districts sometimes may deceive us. When you go there, it's so clear, but in the communities themselves, the social distancing is also not being observed. So the local authorities, I think, have the onus now, and possibly we should involve the security agencies to ensure that people adhere to these measures and to an extent start bringing in the courts so that people can also start facing some of the penalties as spelled out in the laws. Without that, it looks like everybody thinks that it's the usual, business is going on and nobody cares. It's difficult, but we need to make efforts. So for example, this bit about markets, for example, where some regions, let's say Ashanti, they are trying to sort of have some different days for the different people to come in. So through the color codes. Central region, Kaswa is trying to expand the markets, i.e. moving some of the traders from the traditional markets to school parks, stuff like that. We should look at some of these measures and ensure that we make them mandatory throughout the country, especially the two epic centers, Accra, Kumasi, as in Greater Accra and Ashanti region. Of course, there are emerging places like Eastern as well, where we need to send our experiences from Accra and let that be seen to be bearing some fruit in those regions, so that we don't have a situation where by the time...
What about Eastern?
No, it's an emerging in terms of... So we started off with Ashanti and Greater Accra being the places with most of the numbers. Now they are followed by Eastern in terms of the numbers.
Okay.
That's what I'm saying, that we should not allow those regions who are also beginning to record cases to get to the levels of Greater Accra and Ashanti. Else then we have a higher risk.
What we have just witnessed Friday and yesterday, what can the impact be?
I mean,
you have crowds in an installation process and no social distancing, majority no masks.
You see, sometimes we should
just
take...
violating the law and being protected by the police to do so.
We should take advantage of situations like that and deal with, in quotes, the people who are influential. And that will serve as a warning to the rest of us. Whoever gave the orders to the police, assuming without admitting that the police were notified and they went there to give protection. Right from the IGP to the lowest person, people should start having questions to answer for flouting the president's directives. At the local level, I don't know the extent of involvement of, say, the local community, i.e. the district assembly, I mean the administrative structures. People should answer questions. The National and Regional House of Chiefs themselves, they should start asking themselves questions. And then, of course, the institution in that locality, the traditional institution, should also be brought to task. Because we cannot allow things of this nature to happen when we are all trying to fight a common enemy.
You said they should be made to answer questions.
Yes, of course.
For flouting the president's directives.
Yes.
You are a lawyer, and so you know that the president's directives by way of an EI are backed with the force of law. They are law, so to speak. So they have not just flouted directives. They have breached law. Is it just answering questions, or
let me expand.
What is happening? What is happening to preachers who are being arrested here and there is the same thing that should happen to them.
Samson, let me expand quickly. You see, when I started, I said that very influential people should be brought to book for all of us to learn lessons from. So by saying that they should be made to answer questions, what I meant is that they should be taken through the due process, and where they are found to have formally breached the rules, the exact punishment as spelled out, it probably is the maximum, should be given out. That's all I'm trying to say.
Okay.
Because you see, we cannot continue this way. People feel that life is okay with us.
You think that sends very bad signals to everybody else who is watching?
Technically so. That is it. Because you see, this is the traditional authority. We expect that they will also be showing leadership. So if they are also breaching the rules, but of course, we don't have all the facts at our hands. This is just based on what we have seen. And that's why I'm saying that clearly on the evidence as we have seen on the surface, there's a presumption that these things have been done wrongly. That's why I said we should look into the circumstances, and those who ought to be brought to book, we bring them to book for some sanity to prevail. You see, the problem in all this is this, or the biggest risk here is that in our context, the Ghanaian context, what we have seen is that there are a lot of asymptomatic people in the system.
Asymptomatic means what?
These are people who have the infection. Technically speaking, you don't see any obvious signs of illness. Maybe at some point it could happen, because as the disease progresses, depending on how things work out for a particular patient, it could move from mild to moderate to severe or even critical. But within this asymptomatic phase, where they are not showing any symptoms, so they don't have a cough, they don't have a fever, all the things that we've been preaching about, they don't have them. So you see them, and on the surface, it's just like any of us sitting here. So when you bunch up in the numbers as we saw in your clips, you end up, and when I saw the clips, I'm not too sure that I saw even on just a cross section 10% of the people in mask. I don't think so. So what it means is that
let's have that video footage again from Ekwaping where the installation was happening. So
what it means is that all these people, if there are asymptomatic cases amongst them, they are actually yes. You can see. There's one or two people on the surface you can see. You know, so clearly there's a risk out there for everybody involved, including the people who are being installed as chiefs themselves. There's a risk. The leaders of the community, i.e. the traditional authority, as we see them, they are also not
in any holding hands.
Yes,
the very things that
we are talking about. And I don't know how long this procession was. I don't know. But clearly, these are the sort of things that, because let's not forget that we have community spread.
Right.
So whether we like it or not, the disease is with us in our communities. And we cannot pretend that some communities are exempted from anything. You could even have imported cases from other regions. I don't know, people who may have moved from Accra or elsewhere to be part of it. And these are the sort of things we are all trying to talk about.
Okay, so very briefly, Dr. Boaji, so we are watching you guys do a very difficult job. And you're receiving a lot of praise, not locally also, but even internationally. When you see something like this, what does it say to you for the efforts and the work you are putting in?
Yeah, thank you very much. It worries us a lot because the success of this exercise does not only depend on us. It also mostly depends on how people comply with these measures. Otherwise, it's like having a drum with a hole in the bottom. As you pour in, it pours out. So we want to really ensure. And I just saw that nose mask is, you call it nose mask, not mouth mask. And a lot of people who are wearing masks are actually not covering their nose. Right. And I think that is something that we must continue to explain to people that is it. So it really works, and it's not just the masks alone, but all the other measures together is the one that creates that ability not to spread the infection. But what we have also coming out this week is the fact that I think we need to strengthen our protocols. We need to we are going to give clear guidelines that if you are a hairdresser, what should be done in a hairdressing salon. What and what should be done in a barbering salon. Okay. What should be done in the market. I think there's lack of clear guidance on that, and we are coming up very closely with that. We just done that with the local airports. All right. Put tests there. We know how to manage your bags, who wears masks, social distances in the planes, clearly demarcated rules. You know, when you go there, one of the examples I give you that, you know, when you are boarding, they take your ticket and they give you one. Now you'd have your ticket and give them one instead of the other way around, so that everybody. So we need to come up with those things that also keep clear direction.
The delay or seeming lack of proactivity in doing the things you are saying you want to do, doesn't it affect the effectiveness of your fight? For example, after the president has said we should wear the mask and lifted the lockdown, it took a week before we got the directives from you or the minister issuing and telling us what sort of mask, where to wear the mask, how to wear the mask, all of that. It took a week.
Yeah, something, yes. We are in a response mode, and these are things are happening very fast. Maybe what comes out as a directive on paper comes a bit later than the real community education and meeting communities and telling them exactly how to do it, whilst we work through the specifications, etc., to put it out there clearly. So
even before the president begins to tell us that this is what I expect you to do.
Yes, and so those are the things that maybe the write-up that comes a bit late, but as you've heard Dr. Youngson, the media, etc., these education and interactions start way back before the clear these things come out. Maybe it's the write-up that come out late, but in terms of the real action,
we'll flag that as one of the challenges in the progress report that we are going to look at now. So now let me begin with you. Progress. Beyond the platitudes that you are enjoying from all over the place, what can you show us now to vindicate the fact that you have made a lot of progress?
Yeah, thank you very much. When you are faced with such a condition, the real issue is to be able to identify the cases and manage them. And I mean, that's the way I want to put it. And in doing so, we are working towards making sure that we don't get in further imports, and that's why the borders are closed. Right. Now, you need to track people, you need to test people, you need to treat people and isolate them. And that's a very, very important component that we are doing. That's what the Koreans did, that's what all those countries have done. And in that instance, we've been able to test currently about 113,000 people. I mean, for a country of 30 million, we've been able to put a lot of people who are sick in isolation and in treatment, albeit some of them even at home treatment where we feel the environment is appropriate. And now we have people who are not asymptomatic in isolation camps. Yes, we may not have had all of them, but that to me is an important step in ensuring that transmission is, if not curtailed, is significantly being reduced. And to me, that's what it is. And that is why we've still been able to maintain even the positivity rate still low. For example, those who have symptoms and meet the definition for testing, we are only getting about 2.7. I wouldn't want to say the word only. Maybe that's we are getting 2.71%. which is still a low prevalence, looking at other countries where they are getting 10%, 20%. And so that gives us hope that when we started, we were having the same rate, and we've been able to maintain that positivity rate, despite the fact that we've done over 26 or so thousand samples in that group.
Okay.
If you look at the overall testing, we have a positivity rate of 1.83 as the last figure that you quoted. So that is also an indication that you are not also, the infection is not getting out of hand. We wish it is 1% or less than 1%, but that is still a manageable situation that if we ramp up our public health systems, we should be able to contain and put this condition under control. The fortunate thing is that about 85 to 89% of our cases are in Accra. So that creates a good buffer for us to be able to contain, and that's why we have enhanced our activities, especially in the district in Greater Accra where we have cases. So those are the things that we are doing, and we continue to do. We are ramping up our treatment facilities across the country so that anywhere you are able to look at that. Now, with the northern sector, the Volta sector, Volta region, they are not going to have any backlog, so they should be able to report in clear time because of the number of labs that have been. Accra has an epicenter. There are none of cases here, and even by the time we finish all those things, we should be able to.
So now we have in total how many testing centers?
It keeps changing. Yesterday, Konfanachi was added, so we should have close about 8 to 10 now, because we have the Noguchi, the preference lab in Accra, we have the CSR. I'm talking about CSR, and we are now trying to add the police. There's the police lab, the forensic lab, and the veterinary people. And the veterinary people are also part of that group. If you go to Kumasi, now KCCR, they are putting up Konfanoche, is being added to the group. We are working on Takoradi, the reference lab. Tamale, the Pont Tamale, and Navrongo Research Center are on board. So that gives us a large level. Like I said, who last week has tested about 527 cases since it was started about 2 days ago. How about Sunyani? Sunyani, no, we don't have any.
Yeah, because we have heard them suggest that, you know, the research center in Sunyani deserves a certain attention. They have suggested that they have the capacity to do so. But
you mean Kintampo?
Kintampo, yes. But no attention has been paid to them.
Oh, we are looking at it. It's not, you see, the PCR machines, we have regular one, we have the real-time PCR, and that is something else. You see, one thing about that area is that since we started, the 3 Brun-Ahafo regions and Savannah has not reported any case, despite the fact that they are doing a lot of testing, especially Bono East. There's been no case. But of course, that doesn't mean that we will not. But what those groups are doing is preparing all those, including getting a lab and being able to have a way of, even if they don't have a lab, a quick transportation of samples to KCCR or neighboring for the test to be done.
Okay. So, Dr. Jansen, adding to what he has enumerated, quarantine centers, how people who are isolated are being taken care of and the rest, what would you say? Is there some good progress in that space?
Well, you see, clearly we've made a lot of progress in terms of our testing capacity. But we also still have the problem with us because, at least within the short term, we still have the backlog. And what that does is that it impedes our ability to move forward quickly, i.e. getting to know who is positive, picking the patient up quickly to go through treatment and what have you. The more you wait, as in the waiting time, and from what we are seeing, people are also not respecting some of the preventive measures, then there is the likelihood that the person having been tested and awaiting results will still be moving around, and if he turns out to be positive, within that 3, 4 day, 5 day, or 1 week plus, as we've seen in some cases, he has the ability to spread the disease, and that adds on to our case buildup. So if we are able to go through these processes quickly and then get to the point where we can get real-time results, then we'll be able to be ahead of the virus. But as it stands now, we are still struggling because of the initial challenges we all had, because the system itself was not ideally prepared for that. But we are making some strides. But we need to do a lot more. We need to do a lot more. So there's also another challenge associated with the testing. What is happening is that some of the people, upon being tested, it becomes difficult to reach out to them. You see, Kofi said he hasn't had his results, which for all of us is not
he's
something.
Actually making efforts to know.
Yes. And there are also people who are also evading us. You see, if everybody was behaving like Kofi, we'd be fine. But there are people who are evading us. They test, and when you are looking for them, based on whatever results you have and whatever protocols you want them to adhere to or take them through, sometimes you can't find them. You may find them after a longer period, or some you can't even find. You see, and these people are also in the communities.
And these people, when they hear stories like those of Kofi, does it not rather discourage them from wanting to do what you expect them to do?
You see,
Kofi and his kind are being very responsible. He doesn't want to begin to get into, you know, to live a life that is likely to endanger other people.
Which is great.
So he wants to know as quickly as possible his status so that he can decide how he conducts his life. And a month and nothing has come.
You see, Samson, I think that we should all agree and accept the fact that, look, there are sometimes challenges with the system. Those systemic challenges sometimes are not the making of the health professionals. But of course, we need to go around them. And we are doing our best to go around them. At least in Kofi's case, I remember Dr. Abaje stating clearly that if he gets the details, he will make sure he follows up and all that. Sometimes we don't even get to know some of these things. So genuinely, these are some of the problems that we encounter. But for people who are deliberately evading us, sometimes we have patients who have tested positive. We go into the community wanting to get them into the treatment centers, and they are not ready to go.
Okay.
The community gangs up against the health professionals. And this is not right. You know, in Sierra Leone, when the Ebola epidemic started the last time, these were some of the things that happened to them. People actually started attacking the health workers. It got to a point the health workers did not go to them, and that gave them the opportunity, or gave the virus the opportunity to also spread among the very same people we were trying to protect. Okay. So one key thing we all need to look at is our attitudinal influences when it comes to this pandemic and how we are handling it.
All right.
We need to look at our attitude as a people. Okay. It is not the system in terms of the health sector alone, but as individuals and communities, we need to take a lot more responsibilities for our own lives.
Let's pick the views of Dr. Sevakin. And also joining us is Kwame Esiedu Sapong. Kwame Esiedu Sapong. He is a pharmacist and also with the CDD Ghana. Thank you for joining us, Kwame.
Thank you, Samson, for having me.
Great. So you and Dr. Sevakin, I'll get to Dr. Sevakin and come to you because there is another angle we would like to bring you on about this whole thing. Now, Doc, the questions being asked is about, can't we be clear about our turnaround time as far as the tests are concerned? You are the ones doing the test.
Indeed, Samson, we are always very clear about the turnaround time. We know that between 6 to 8 hours, we should be able to give you the results. But again, it boils down to the starting specimen. So the specimen presented. For example, we know that currently we are using sputum. You know, sputum is mucoid. So when we receive sputum in our labs, we have to do some pre-preparation activities. And this can really take a very, very long time. We know that thankfully, we have received some swabs. So actually for us at KCCR, we are really looking very much forward to receiving the swabs. Now, when we receive swabs, you don't need any pre-preparation activities. You just start processing the sample. So you do your RNA isolation or extraction. You go on to do your amplification, and then you have your results. But if I have received sputum, then I need to spend a lot of time. So these are some of the challenges. And again, I mean, for us, we are even also excited that now there are other testing sites. But we also need to recognize that this virus is a typical, we call it biosafety level 4 virus. So even for all the testing labs, we never work with a live virus. So we never culture the virus. If you want to do that, then you need a biosafety level 4.
When can we look to real-time results?
So we can look at real-time results when we don't have backlogs. Because if we have backlogs because we had limited testing sites. But now, thankfully, we have set up 2 labs in Tamale, one in Tamale and one in Pont Tamale. I know that next week, Western Region will come on board. We know that in Kumasi, Konfanoche will come on board hopefully next week. So once we expand and we have more testing sites, then the issue of backlogs, and importantly, we'll be able to also produce or provide real-time results. I mean, we are all interested in giving out real-time results, but then with the limited testing sites we have, we can only, at a point in time, work on the number of samples we have. And so as the days goes on, we end up getting some few backlogs. But we are actually clearing all those backlogs. So we have given ourselves up to early next week to ensure that we don't have any backlogs.
Very interesting. Let me get to Kwame Siedu-Sapong. And Kwame, first of all, we are excited to know that you have volunteered or you are part of the process in the UK to assist, in their fight. What exactly are you doing, and what do you see that you think would be useful for Ghana?
Thank you, Samson. I'm doing a number of things. I mean, at the moment, I'm working as just a pharmacist, which I've not done for a pretty long time because obviously you do the management and other things. But in this fight, it's all hands on deck. So my day job basically now is a frontline pharmacist who actually dispenses advice, picks up the phones, speaks to people who are anxious, makes sure people's medication, especially all those over 70 who've been, shielded off and are not allowed to come out, so to speak, because they're being protected from the virus, to make sure that there's a supply chain going on and they can receive all their medicines on time. So that's what I do in the day job. But I'm also involved. I did volunteer, as you rightly said, to be one of the first people to actually get jabbed with this vaccine, which some might think I'm a bit crazy. Some of my colleagues felt I was crazy. But the reason why I did it was that if you look at the UK statistics, about 72% of all people who've passed away are from Black and ethnic minority groups. So disproportionately, the Black man, the Asian, are dying compared to the whites, the Caucasians, and others. But when it comes to participation in clinical trials, less than 10% of us are willing to volunteer. So this was the question I asked myself. I said, if we are the ones who are going to lose our lives, and we are not prepared to stand up and dare to die, then obviously we are not prepared to dare to live as well, because we are going to become sitting backs and get hit. So yes, I took that job, and I also am participating in the Turkish trial where they are giving a number of medicines to frontline workers to prevent the virus actually from attacking them and culturing. So they are using 3 medicines, which obviously I wouldn't want to go into details about it. So those are the 2 things that I'm doing. So it's not just about talking, it's also about stepping up to the plate and trying to be part of the fight.
Right. So You have also observed how Ghana has been managing this so far. The Ghana team has received a lot of applause, but there obviously are challenges as well. From where you sit, share with us your observations.
You see, Samson, the way I look at help, and for that matter, science, is always not to say how well you've done, but how better you could have done. So I come from the standpoint of not actually saying, oh, you've not done anything. Because both Dr. Abuaji and Dr. Jansen would know that as scientists, what we do is to gather body of evidence. So it starts by the body of science building for individuals and teams doing their research, publishing research papers, which go through peer review. Then as it's approved and published in established journals, people then gather the primary research into secondary research and do systematic reviews. Then for us in health, there's what we call the Cochrane reviews, which are the brand one science that we go from. So when I'm looking at anything, I'm always trying to look at it from that critical perspective. And therefore, yes, I would say that Ghana has done quite well, but there's a lot more we could have done. And I listened to Dr. Abuaji when he was speaking. For example, when you look at our testing, I heard on Joy a couple of days ago about a pathologist from the military hospital who was saying that someone had tested negative, but when they had done the autopsy, they had found out that they had tested positive for COVID. That throws up a number of things.
Okay.
It could be that, yes, they
so do
negative.
do this. Hold on there for me briefly. Let's hear exactly what the pathologist had to say about this examination that they did, and then we'll come to you. Let's hear the pathologist.
Postmortem unravels so many things. Initially, I've done 2 cases that results came as negative. The family wanted to know. But subsequent tests that we took during postmortem proved positive.
This is a principal part of the fighting with the COVID. We can now do our research, our investigation to support the treatment we are doing giving to the patients.
All right, so that's the pathologist there who was speaking to Lateef Idris about the issue that you mentioned. And you say it throws up a number of issues. Yes.
It throws up a number of things. The first thing is the person could have genuinely been negative at the time the test was done. Yes. And subsequently, with a virus that is so virulent, might have contracted the disease later on down the line, and then subsequently died. It could even be a hospital-acquired infection when you went into the infection because they placed there. That's one thing. It could be that the test was negative because the incubation period of the virus is such that if the test was done too early, it wouldn't be picked, and therefore they will test negative. But then the incubation is going on.
Okay.
It could also be what is called in science a false negative, where the actual person was positive, but it turned out negative, which then has issues to do with, is it a systematic error? Is it a sampling error? Is it even got to do with the sensitivity of the test? So when things like this happen, we need to look at it with a critical eye and ask ourselves, what is going on here? Because that could impact, if, for example, it's a false negative. Statistically, how many false negatives are we having? Is it statistically significant? Does it then mean that a proportion of the people who probably have tested negative in our test are actually positives? That is one thing to look at. Then, if you had Dr. Abuaji,
and in this case, they actually did a postmortem on 2.
Yes.
Who had tested negative, but on postmortem examination were positive.
Yes. So if it's 2, it opens up a can of worms, and then you ask yourself, how many more exist? So these are the things I'm looking at. And then the other thing from a testing standpoint is what Dr. Abuaji was talking about. And he said, if you realize our ratio of positive tests to total tests has gone up from 1.5 to 1.83. It is true that it's still very low compared to other countries, but it is also true that statistically, our test positives has gone up by 20% because it's increased by 0.33. And the baseline is 1.5. So 0.33 divided by 1.5 times 100 is 20%. If you are getting a 20% spike with a virus which is known to have a reproductive number close to 3, you should be concerned, especially when you look at it from the point of view that it took us close to 39 days to move from our first 2 cases to over 1,000 cases, 1,042. But it took us less than 6 days to go from there to 1,550, which is a clear indication that our doubling time has also changed. And that should be another concern for us. Then if you disaggregate Ghana and you look at the different curves, because like you see, in Accra, they are on a different trajectory from the rest of the country. But if you look at Ashanti region now, Ashanti region is also beginning to pick up. If you then factor in because if you look at any disease, especially an infectious disease, what we call the R0 or the reproductive number changes and varies as the disease goes on. Because even if you introduce interventions like social distancing, it's going to affect the infectivity of the virus. So if you look at Ghana, we've done a rough calculation and we have an idea what the R number for Ghana is. But the problems with it is, what is the lag time between the reports we are seeing on the Ghana Health Service portal, which we are using to do the calculations, and when sampling is picked? And so we are talking about it as a crude number. But even with that crude number, we are concerned because we definitely know that Ghana is in an exponential phase. And we are concerned because the president is right in saying that in this phase, we should use face masks because you want to stop the transmission of the virus. But people are not doing it. We saw what happened in Ekwapim. We're seeing it in some markets and all that. And so if we are not going to do these things, then try as the Ghana Health Service may do with the best will in the world, we would still have issues. The final thing I would say before I go is, another thing we've not picked up on is that if you look up till last Sunday, our mortality was 11. We had lost only 11 people to COVID. By Wednesday it went up to 16. Thursday it went up to 17. That is a spike of 54%. So though you would say that our mortality is low, the changes that are taking place in the underlying data are concerning for people like us who look at it from a critical and peer review standpoint and say, yes, they are doing a lot, but there seems to be some seismic changes that are taking place that we need to be cognizant of.
Okay, so what I'll do now, I'll take a quick break. When we return, we'll get to Dr. Aboagye because a number of questions are coming up for him as regards, this some of the comments that he himself has made suggesting it does look as if we have, flattened or managed our curve, and a couple of other matters that are coming up. We'll be right back.